Good morning, everyone. Thank you for joining us today. My name is Erin Kopek, and I am the Director of Marketing for HireLevel. And today you have joined our exciting webinar program, our Workplace Excellence program. We've been doing this program for a few years as a value add to all of you, and we hope you appreciate the information today. A couple of the housekeeping things before we get started. You are set up in listen-only mode. You are able to ask questions throughout the webinar or at the end with the question pane at the bottom of your GoToWebinar toolbar. Please feel free to ask Adam questions, and we will do our best to get those answered for you. This call today should last a little bit less than an hour, and we are looking forward to kind of kicking off the morning. I'm going to go ahead and introduce Adam Berkowitz. He is our presenter today, founder and president of Simpara. Adam is passionate founder and president. He's a modern HR and benefits firm with a focus on a more efficient, people-centered approach. After a decade in the field, the pay more, get less annual healthcare discussion grew tiresome, and Berkowitz realized employers weren't getting the value they deserved. Determined to change the status quo, he founded Simpara in September of 2016. Due to his excellent work, in his first 18 months, Adam was named a 2018 Rising Star in Advising by EBA Magazine, and Simpara was also named as one of the St. Louis Small Business Monthly Future 50 Companies on the Rise. Adam is a certified health underwriter. He has also been featured in an array of media channels, including the St. Louis Post-Dispatch, EBA Magazine, and Kaiser Health News. Thank you, Adam, for joining us this morning, and I turn it over to you.
Thanks, Erin, and good morning, everybody. Appreciate everyone's time today. It was a great intro, and we're going to spend some time talking about healthcare. Hopefully this is a relevant topic this time of year. And the topic of our presentation is restoring the American dream. And we're going to talk a little bit about why that is and how passionate we are about this. But little intro about me first. So 2 years ago, this business came into an existence, and after a decade in the field, I would describe myself as your typical young invincible male. Never had a true experience firsthand in the healthcare system, although I've been dealing with benefits in healthcare my entire life. That all changed. July of 2016, my wife and I welcomed James, our first son, and unfortunately, it was a traumatic pregnancy, and it resulted in about 2 months of around-the-clock opioids from my wife. And you learn firsthand that there's not a strong advocate working with you when you're that deep in the healthcare system. And so you learn quickly that you have to be your own advocate. And thankfully, everybody's okay, everybody's healthy. But that was the watershed moment for me. I knew that if we were going to change the system, being a brokering health insurance, delivering increases year over year, it had to change. Healthcare is too important, it's too personal, and that was the synthesis for everything that we're doing today. So this is a photo of me and my son. We're actually writing my business plan for what it is now, Simpara. And what an excellent journey it's been. Really excited to have all you guys on the call today. We're going to talk about healthcare. We're talking about how we can fix it, because the fixes exist. I'm really excited to talk about kind of where we're coming from, lay the foundation, and then talk about what's working. We've studied businesses across the country, large, small, urban and rural, white collar, blue collar, and there is a similarity. The companies that are doing it the best, the companies that are providing the best healthcare to their employees, are able to do so at 40 to 50% less than the national average. And the national average is about $12,000 per employee per year. It's crazy. And so I show this slide because I think it's a good framing of the conversation, which is that we have to change our thinking. We've been taught for a very long time that healthcare is messy, that it's expensive, that it's only getting worse. And the truth is, it doesn't have to be. So we just have to change our thinking a little bit. So why do we call this restoring the American dream? Well, we're spending so much money on healthcare, $3.4 trillion on healthcare. That's nearly 20% of the GDP. It's approaching that at least. That's up from gosh, less than 10%, not even a decade ago. Millennials are on track to spend more than half of their lifetime earnings on healthcare alone. So that's what they pay in premium, what they pay in deductibles every year, co-pays, what their employers pay for their portion of the health insurance, and what you're paying in taxes for Medicare and Social Security. Half of our lifetime earnings. And if we look back at the last 20 years, while employers have been giving generous raises year over year, the truth is every single dollar has gone to pay for healthcare. And this was the Federal Reserve of St. Louis came out with this study and the cost shifting that's occurred in healthcare. So while we're making more money, it doesn't feel that way. Middle class has been in a 20-year rut of wage stagnation due primarily, almost solely, to healthcare. The rising inflation and cost shifting that's occurred through higher deductibles, higher copays, more and more premium shifts year over year, it's kept our wages flat. If we look at the data a different way, we can see that what we're spending on healthcare is far outpacing spending in every other consumer category, nearly by 3 to 4 times. So what we're spending on housing, food, shelter, transportation, it's gone down. We have less liquid assets to spend on these necessities because healthcare is still on our paycheck. And so the question is, 20 years of cost shifting, is it working? We can't continue to operate in the status quo because this slide right here frightens me. It terrifies me. And I show it to all my clients and all my prospects because to me, this is the watershed. This is the turning point. This is where we have to shift our perspective because if we're going to take control, if we're going to provide an amazing benefit to our employees, it's critical that we keep it affordable. Not just affordable, but that we can actually reduce the cost and give everybody a pay raise. So before we get into the fixes, let's talk about kind of the 4, I think, critical pieces of the healthcare supply chain that are keeping things the way they are. We say the fixes aren't coming from Washington, D.C. and why? If we go back to that slide that there's $3.4 trillion in healthcare, there's $3.4 trillion why things are the way that they are. Nobody wants to give up their slice of the pie. And so if we look at some of these competing interests, healthcare is highly, highly extractive. There's a lot of players up and down the supply chain that are taking a lot of value out. They're being paid handsomely and providing very little value in return. So this might make a few people uncomfortable. I don't mean to bash anybody directly, but I came from this world. I used to be a typical health insurance broker for the majority of my career. So I feel comfortable saying this. Every year we would get our renewals for our clients. We'd give them a phone call or shoot them an email and say, hey, I've got bad news. Your rates are going up 20%. 20%. That was a very typical conversation. The good news is we shopped your plan. We looked at 3 or 4 other insurance companies. We were able to get your increase down to 10%. And we had the audacity to say, we saved you 10%. What other business can you say that that's saving somebody money? It's a 10% increase. And so I often say insurance products won't fix your healthcare cost problem. The reason healthcare is so expensive, the reason health insurance is so expensive is because we pay a lot for healthcare. And so focusing on insurance, that's just a transfer of the risk. You're ignoring the cost of healthcare. If we focus only on insurance, we're ignoring the cost of healthcare. So it makes sense that if we can actually reduce what we're paying in healthcare, okay? So if we take an example like an MRI, you can go to Metro Imaging or Open MRI and pay $300 for an MRI. But if you go to a big hospital system, that same MRI is going to cost about $4,000 to $5,000. But I guarantee it's the same magnets. There's no difference in the result or the quality of that MRI machine, whether you get it from a hospital or you get it from an imaging center like a Metro Imaging or an Open MRI. And so if we can pay less for healthcare, it makes sense that we're going to pay less in health insurance. But most of the time, this fact is ignored in every single conversation when we're dealing with our insurance renewals year over year over year. The other culprit in this game is your PPO. And I'm sure you guys have heard time and time again that if you go in network, you're getting a wonderful discount. And I'm sure you've seen it. If you've ever gotten one of those things that's called an explanation of benefits, and I would argue that it does everything but provide an explanation of benefits. They're highly complicated documents to understand. You almost need a PhD. So that EOB you probably have seen has a billed amount, a charged amount, and an allowed amount. And that allowed amount is your PPO discount. And you've probably been told that that discount, or you see it, is anywhere from 40 to 50, sometimes 60% off of the billed charge. And in healthcare, we've accepted this because we don't know the cost of healthcare. Well, that's changing. So we have data. These are two hospitals. These are two local hospitals, Mercy Hospital and St. Clair Hospital. Don't mean to pick on them, but we have data. And if we look at the bill charge for a coronary bypass, okay, and we take that typical 45% PPO discount, we know that you're still overpaying. If we inflate the starting price by 5 to 6 times what it actually costs to deliver that care, a 45% discount is garbage. It doesn't mean anything. These prices are completely made up. You might have heard the term charge master. Nobody ever pays the bill price. Nobody. It doesn't exist. With or without insurance, nobody pays that price. And we know, because Medicare publishes the rates, what it actually costs to deliver any type of healthcare service. So in this example of coronary bypass, Medicare says it should only cost about $38,000. So if we take Medicare's rate and we provide some room for profit, this is a generous 50% bump. We call it cost plus pricing. We're still underpaying what your PPO did by $23,000. And this is happening up and down every single healthcare service. It's not just big things like bypasses. It comes into play with MRIs, with labs, with doctor visits. So this myth of PPO discounts, we believe that in the next 5 to 10 years, PPOs will be a thing of the past. The other thing is quality. If you look at a PPO and you look at the list of doctors that are covered, or the list of surgeons that are covered, how do you know that you're getting quality care? In the same network, you're going to have all of these doctors. So this is a snapshot we did using Cigna's PPO in a specific MSA, and we found that only 25% of their in-network doctors were licensed, board certified, had fellowship, no state sanctions, and this is where it gets really fun, no criminal charges, and no medical malpractice history. 25%. So the joke we like to say is, what do you call the doctor who graduated last in his class? You call him doctor. There is no great metric, there's no great tool available to help a patient, a consumer, navigate cost and quality in the existing healthcare system. And this is why healthcare is so expensive, because there's no transparency. And so market forces aren't allowed to compete. And so what we're trying to do is pull back the curtain a little bit and give employees the tools to be successful, to successfully navigate healthcare, to get the right care at the right time at the right place and for the right price. This other one may be a little bit obvious, but the insurance companies. So there's only 4, maybe I would argue 3, United Healthcare, Anthem Blue Cross, Cigna, and Aetna. And if you've noticed, there's a lot of consolidation happening. Pharmacy companies are buying insurance companies. Insurance companies are buying pharmacy companies. Express Scripts was just acquired last week. If we look at the stock price of the insurance companies over the last 10 years since the ACA passed, the Affordable Care Act, you're noticing incredible growth, especially Cigna, almost 750% stock price growth since the Affordable Care Act passed. Compare that to the S&P of only 316% growth, it's enormous. And the reason that this is happening is a little rule packed into the Affordable Care Act called the medical loss ratio. And what this is doing is it's capping. It sounds like a good idea. We're capping profits. We're saying insurance companies must spend 85 cents of every dollar they collect in premium on the cost of healthcare. They can only keep 15 cents of that dollar for things like overhead, marketing, and profit. And so if you think about it, it's a fraction, it's a pie. If you can only keep 15% of $1,000 or 15% of $10,000, what would you choose? And so over time, The only way for insurance companies to provide shareholder return year over year is to increase your premium. There's no other way around it. And that's exactly what we've seen happen. And we say, is this industry ripe for disruption? Absolutely. This is the stock price on the day that Amazon, Berkshire Hathaway, JP Morgan Chase announced their new healthcare venture. They didn't give a single detail about what they were doing. They just said, we're coming together to figure out how to fix healthcare. And look at the tank. It's unbelievable. The last one we're going to talk about is pharmacy. Pharmacy, we can probably spend the entire hour on. I'm going to focus on just one drug, Duexis. If you don't know if your health plan covers this drug, you should look it up, because Duexis costs about $2,300 for a 90-day supply. And what is Duexis? It's just 2 common pills that you can buy over the counter, Ibuprofen and Pepcid. You can probably get both for about 20 to 30 bucks. So why is the health plan paying $2,000 or more for the same medication? And so when we start pulling the curtain back, peeling the layers of this onion apart, this is where we see the abuses taking place in the healthcare system, because this shouldn't be allowed to exist. So let's get to the solutions. What are we doing to fix healthcare? What are we seeing that's working? And how great is it working? We often say to our clients, you run a healthcare business whether you like it or not. What we mean by that is healthcare is typically a top 5 expense for your business. It usually comes right after salary. It usually comes right before workers' comp. It's usually a top 5 expense. So we're spending significant amount of money on healthcare. And yet every year, we don't treat healthcare as a top line investment in our people. We treat it as an expense that continues to go up and up and up every year, as if that's just the way things are. It doesn't have to be. Warren Buffett famously said, GM is a health and benefits company with an auto company attached. He said this because GM spends more money on healthcare than they do on steel. Likewise, Starbucks is paying more on healthcare than they do on coffee beans. They're in the healthcare business. So what are the solutions? We've looked at companies across the entire United States. We've looked at what's working and what's not working, and the companies that are doing it the best are spending 40 to 50% less than everyone else, and they're providing some of the most impressive benefit packages we've ever seen. And so we're taking those models and we're scaling them because we know they work. We call it evidence-based healthcare purchasing. And this is a cartoon we show a lot because it's a typical conversation. What if we wait and see what the Affordable Care Act is going to do next year? What if we wait and see if this new association plan is going to materialize? What if we wait and see what government's going to do next? And every year, our costs go up and up and up. And the ones that get harmed the most are employees, because their wages have been flat for the last 20 years. So here's the recipe. You guys can write this down. We're giving away our secrets. We know that these 7 pillars make up a phenomenal benefit package, that if companies utilize these 7 approaches, they're going to not only provide some of the best healthcare to their people, but they're going to spend 40 to 50% less than their peers. And it's sustainable. Once you've optimized your healthcare plan, you shouldn't see 12 to 20% increases year over year. You should see inflationary increases, maybe 1 to 2% at best. But it's a long-term game. So we don't do all of these things in the first year. We build a roadmap. This is a 3 to 5 year trajectory, and there are different levers we can pull. And how we get there with each one of these buckets is going to look different for every company, because there's thousands of solutions that we can pack into each and every one of these pillars. We're going to focus on a couple of them. In action, this is probably the best example we found. Rosen Hotels is based out of Orlando, Florida, and he's paying 55% less on healthcare. He's saved approximately $240 million over the last 2.5 decades because he's chosen to optimize how they're purchasing healthcare. What does that mean for his business? 10 times employee growth, 83% lower turnover, and we're talking about hospitality. This is typically a high turnover industry. This is typically a low wage industry. This is typically English as a second language industry. We have high rates of HIV in this population, and yet Rosen Hotels continues to beat the market significantly. So what have they done with this money? It's impressive. It's really impressive. All their employees, all of their kids get free college tuition. And there's still room left over to keep profit into the business with the savings. In addition, they're investing over $11 million in community programs because they know that things like opioid epidemics, crime rates, if they're going to be a pillar in the community, they can take their healthcare savings and reinvest into their community, and everyone's going to be better off. So when we look at something like this, we know the economic impact. We know that we can bring significant stimulus to our regions, to our local communities, just by optimizing how we're purchasing healthcare. And it's not rocket science. Here's a smaller employer. This company only has 120 employees. They're based out of Sun Prairie, Wisconsin. For the last 3 years, they haven't had a single cost increase. Costs have been flat. And this is coming on the heels of 30% cost reduction when they optimized their plan 3 years ago. So they had a challenge. They said to all their employees, if we can keep our costs flat, we're going to take everybody to Vail. And that's exactly what they did. This past summer, all their employees and their family members went on an all-expense paid trip to Vail, Colorado on the company's dime. All of that is a result of everything they've saved in healthcare. And if you think my company's too small, we can't do this, it's impossible, you have to be a huge company to optimize your healthcare, let's look at this one. This is Central Institute for the Deaf. They're right off of Kings Highway, right by Barnes Jewish Hospital. They're facing a 20% increase this year with Aetna, this year. What we did with them is we unbundled their plan, okay? We optimized how they're purchasing insurance. We optimized how they're purchasing medications. We optimize how employees are accessing the healthcare system. And so what does that look like for an employee? There's no network. They can go anywhere they want. There's no if you go to the ER and the anesthesiologist isn't in network, you're going to get a bill. There's no radiology bill for going out of network. Everybody's covered, okay? There's no deductible. So now we've taken what is typically a barrier to access healthcare, a $1,500, $2,000 deductible, and we reduced it to zero. So employees are now getting immediate access to care. There's no barrier to care. It's highly, highly affordable healthcare anywhere they want. And for those high cost medications, for those brand name and specialty drugs that we have a few employees taking, we took away their copay. They're getting their drugs delivered to their doorstep for free. Central Institute for the Deaf was able to stem a 20% increase to zero by doing these things. It is highly, highly effective. And if you want to know how many employees they have, 47. So you don't have to be a large employer to do this. The solutions are real and they exist. They're very tangible. And so for us, the exciting thing about what we're doing is for the first time employees are being told your costs are staying the same, or you're getting a pay raise this year. When have they ever been told that their premium is actually going down? What we're taking out of your paycheck is going down on healthcare. Your deductibles are going away for the first time ever. So instead of raising our deductibles year over year over year, your deductibles are going away. You can now get your medications, the ones that you really need that are incredibly expensive, absolutely free. This is why we do what we do. And it is so empowering to see the smiles on everyone's faces and the sighs of relief when it's typically a very nervous time of year. Employees are sitting waiting for the bad news and they hear this. So the greatest danger in times of turbulence is not the turbulence. It's acting with yesterday's logic. It goes back to what we said with the quote from Albert Einstein. We have to change our way of thinking. We have to focus on the cost of healthcare and how we're delivering healthcare to our employees to optimize our costs. And the employers that are doing it, they're going to be the ones that are successful long term. These are the ones that are going to have higher profit margins. They're going to beat out their competitions. They're going to retain their employees. They're going to be able to recruit some of the best talent in the field, all because they're able to optimize what they're spending on healthcare. So I've got my email, I've got my phone number. I'm an open book. So this kind of wraps up the formal side of the presentation. We'll open it up to questions and answers, and I encourage you guys to reach out offline if other questions arise. Thank you so much.
All right, thank you, Adam. Now's the time to type in your questions in the message box at the bottom of your control panel if anyone has any questions that they would like to ask. I'll give you a couple minutes. All right, Craig, thank you for your information. I will make sure Adam has this information to contact you offline. All right, we have a question that's coming in. How small is too small to benefit from?
That's a really good question. You know, I think that we've been able to successfully optimize plans for companies with as few as 5 employees. However, it really all depends on, you know, it really all depends on the risk profile of the group. So how much healthcare is being consumed. A lot of times we don't know that until we really do some digging and figuring out what medications people are taking, what kind of healthcare needs people need. But there are strategies down for very small employers. And one of the things that we're working on is making these types of fixes even more accessible to really small employers. Those with, you know, less than 20 employees tends to be the hardest market for this type of cost optimization. But we're doing things with various association arrangements and captive arrangements where we're pooling risk. So from an accessibility perspective, I'd say my short answer is more is coming soon, but there's absolutely some things you can do today to achieve this type of result.
Okay, great, thank you. Well, I do not see any more questions, so we will go ahead and wrap up. Again, thank you all for attending today and spending your morning with us, and thanks again to you, Adam.
Thank you.